There are 5 keys to health that just makes us feel great, I guess, by following these 5 keys. Tell me about those, Dr. Fisher.
Yeah, they will help keep you alive, believe it or not. First one is diet or food. You need to eat or you will not exist any longer sooner or later. And the second one is to exercise. We need to exercise. Our body even changes positions at night just to get movement in it because we need that. And when we need to rest, we need to get the proper amount of sleep, anywhere from 5 to 9 hours. Less than that, you're depriving yourself, and more than that is probably mind over mattress, as opposed to actual need. And then the fourth key to health is a positive mental attitude. Okay.
I like that PMA. I love that.
No,
Positive.
PMS.
Exactly. I know that's the opposite, huh? But this positive mental attitude is so important, I think, in general health. I love that.
Yeah, people, if they don't want to get well, won't get well. And people it's amazing to me, and that's one of the things that I run in with athletes in this positive mental attitude. They're usually got that going for themselves. And so sometimes they're one of my harder patients to help understand why they need to further treatment other than getting past their pain.
Well, and that leads us to number 5, which is this whole nervous system. Tell me about that.
It's a normal working nervous system. We need to have 100% of that nerve supply going to every part of our body. In chiropractic, we believe we have an innate intelligence, or an inborn intelligence, if you will. In the spiritual world, they would probably call that your spirit. I won't say they're one and the same, but they're pretty close buddies, because wherever there's life, there's spirit. Wherever there's life, there's nerve supply. Okay? And so we need to get that to every part of every organ and every tissue of our body. And what happens sometimes is we get what's called a subluxation, or a bone that's moved out of place slightly. And when it happens to move out of place slightly, it puts pressure on some of those nerves. And depending on where they go, you may have pain, or you may never know it's there until you have come up with some illness or some other injury.
Exactly. Well, sometimes you just don't feel good. Sometimes there's no reason for it, but you just don't feel good. And that might be when something's out of alignment.
Exactly, or many are out of alignment in your body. And that's why people just kind of don't feel good. Some people can even get depressed and whatnot.
And you mentioned the sleep, and if you're moving in your sleep because your body needs to move, you might even sleep funny on something, and that could even cause it. But we're talking even falls and obvious things could push it out of alignment.
Exactly, even repetitive things that you do over and over again, or sitting at your computer. Nowadays, people are spending so much more time at the computer.
Yeah, I get achy after a while.
There's a new term out there with guys, texters. Texters have subluxations now, even in their thumbs, if you will, because they're texting so much. And
now, all of that, though, traces back to the spine.
that's exactly right, because the nerve supply even to those fingers or at the desk with doing your typing and so forth come from the lower part of the neck. And if you get in a position for any length of time, it'll slowly but surely, it's like micro trauma to those bones, and they'll actually move out of place.
Okay, so for chiropractic care for my spine, what do you suggest as far as a monthly visit, every 6 months?
Yeah, it depends on each of the patients. It's a little bit different. And that's why a patient comes into our office, we do a complete consultation with them, complete history on them, of what's going on. And we follow that up with an examination and checking their whole body and different things that are going on with them. And then based upon that, we'll actually take x-rays before we even make a first adjustment.
Well, and when you're talking about, needing to come in and talk to your chiropractor, I don't need to have necessarily symptoms, or maybe I have some symptoms that I don't know what. You had mentioned earlier to me about an earache, ear infection for kids. I wouldn't think to be calling my chiropractor for something like that, but that can be traced back to someplace in the spine.
Well, children are exciting to me. I had 6 of my own. They're all girls. And we adjusted them from the time that they were little tiny babies. The youngest, soonest I've ever adjusted a baby was an hour old, But we've helped them with a lot of them. One of my most, I don't know what I call it, outstanding, most standout cases was on a little 1.5-year-old baby that they wanted to put tubes in her ears. But they wouldn't do it. The mother was coming in as a patient, and they wouldn't do the surgery because she had an ear infection. They wanted to wait for 3 weeks. So I said, well, we've got 3 weeks. You want to let me adjust her? And so I adjusted her for 3 weeks. Went into the doctor for the checkup before the surgery, said that they were cleared. We didn't need to do the surgery.
You must love that kind of result, and being able to, the mother must have loved that, and the child too, took that pain away. So issues that you might be feeling, what are the things that we might be thinking about that we want to come in and have that checked?
Well, even some people that just have a general don't feel good. They don't have the energy that they like to have. I mean, that's a big one. A big one is energy.
And we all hear that, especially as mothers.
Well, especially most of us are going to live to be a lot longer than our parents or grandparents lived to be. And so, how do you want to spend them? This way or this way?
And you do see a lot of that. I mean, if you're not feeling well, you just tend to slump over and you've got that sorry face.
You will lose your posture. You possibly will. And so it is important to get checked.
Optimal living, that's what you provide us with, correct?
That's right. That's the way that we want to have it for each of us.
Now let's talk about an adjustment. This is your daughter here and we're adjusting her back. Tell me a little bit about the adjustment process.
The adjustment, we're trying to move a bone slowly but surely back into its alignment, back where it should be. And as we do that, it takes pressure off the nerves because there's openings for those nerves, and there's 300,000 nerves coming out of them. So when we're adjusting in the mid-back here, this one area here goes to her stomach, and it helps to give her a better nerve supply so she can digest food or take her vitamins that are now going to be better absorbed in the body and better taken.
Interesting. And as you run your fingers up and down the spine there, you can feel where and what needs to be adjusted.
Yeah, and you can feel a little, I can feel a little difference in the change in the spine up in here, and so I can feel there's tightness in here.
So adjustments can be done on a monthly or possibly even more than that as needed, and all it takes is a consultation with you.
Yes, you come in for a consultation, give us a call at 752-5522.
Dr. Fisher, your office here is beautiful, and you've got great equipment for, I guess this rehab type stuff.
This is rehab in area here because we want to build, and we aren't going to make you muscular in this area here. What we're going to work with is to help you increase the mobility and the motion in those joints.
It's really all about good living and feeling good every day.
That's what we want.
I love
everybody.
it. Thank you, Dr. Fisher.
You bet. Thank you.